What is Bupropion? Bupropion is an antidepressant medication that treats major depressive disorder, seasonal affective disorder, and is used to help people to quit smoking. It is thought to work by changing levels of certain chemicals in the brain. Zyban brand of Bupropion is used to help stop smoking, and other brands of Bupropion may be used for MDD or SID. Bupropion is sold under different brand names. If you are already taking medicine for depression or to help you stop smoking, discuss this with your doctor before taking Bupropion. It is very important that you receive only one prescription at a time for Bupropion. This medicine is available only with your doctor's prescription. How it works. Bupropion belongs to a class of drugs called antidepressant. A class of drugs is a group of medications that work in a similar way. These drugs are often used to treat similar conditions. Bupropion works by increasing the activity of natural chemicals in your brain. Your nerves use these chemicals to send messages to each other. These chemicals include dopamine and norepinephrine. How to use. Take this medicine only as directed by a doctor. Do not use more of it, do not use it more often, and do not use it for a longer time than your doctor ordered. To do so may increase the chance of side effects. This medicine should come with a medication guide. Read and follow these instructions carefully. Ask your doctor if you have any questions. Use only the brand of this medicine that your doctor prescribed. Different brands may not work the same way. Swallow the tablets whole, do not break, crush, or chew it. You may take this medicine with or without food, but if you have nausea, take the medicine with food. A part of the extended release tablet may pass into your stool. This is normal and is nothing to worry about. Use of Zyban tablets. You may continue to smoke for about 1 week after you start this medicine. Set a target date to quit smoking during your second week of treatment. If you are still having trouble with quitting after using the medicine for at least 7 weeks, talk to your doctor. If you use a nicotine product together with Zyban, do not smoke. Smoking may increase the chance of serious side effects. If you have trouble sleeping, insomnia, do not take this medicine too close to bedtime. If you use this medicine to prevent depression with seasonal affective disorder, take it during the autumn season before your symptoms start. Continue using the medicine for the winter season and until early spring. Dosing. Oral dosage form extended release tablets. For depression. Adults. Aplenzin, at first 174 mg once a day in the morning. Your doctor may adjust your dose as needed. However, the dose is usually not more than 522 mg per day. Forfivo XL, 450 mg once a day. Wellbutrin XL, at first 150 mg once a day in the morning. Your doctor may adjust your dose as needed. However, the dose is usually not more than 450 mg per day. Children use and dose must be determined by a doctor. For seasonal affective disorder, adults, Aplenzin, at first 174 mg once a day in the morning. Your doctor may adjust your dose as needed. However, the dose is usually not more than 522 mg per day. Wellbutrin XL, at first 150 mg once a day in the morning. Your doctor may adjust your dose as needed. However, the dose is usually not more than 300 mg once a day. Children use and dose must be determined by a doctor. For oral dosage form, sustained release tablets. For depression, adults, at first, 150 mg once a day in the morning. Your doctor may adjust your dose as needed. However, the dose is usually not more than 200 mg 2 times per day, taken at least 8 hours apart. Children use and dose must be determined by a doctor. To quit smoking, adults, at first, 150 mg once a day for the first 3 days. Your doctor may adjust your dose as needed. However, the dose is usually not more than 300 mg per day. For oral dosage form tablets. For depression, adults, at first 100 mg 2 times per day. Your doctor may adjust your dose as needed. However, the dose is usually not more than 150 mg 3 times per day, taken at least 6 hours apart. Children use and dose must be determined by a doctor. Contraindications. Patients who are hypersensitive to or allergic to Bupropion or its constituents should not use their medication. Seizure disorder is a major contraindication for Bupropion therapy. In addition, bupropion is also contraindicated for any other factors predisposing to seizures, i.e. discontinuation of alcohol or sedatives, arteriovenous malformations, severe head injury, severe stroke, brain tumor, or other significant central nervous system disease. Patients taking monoamine oxidase inhibitors should not take bupropion, nor should those taking linezolid or methylene blue. What to avoid? Drinking alcohol with bupropion may increase your risk of seizures. If you drink alcohol regularly, talk with your doctor before changing the amount you drink. This medicine can also cause seizures in people who drink a lot of alcohol and then suddenly quit drinking when they start using the medication. Bupropion may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Bupropion may interact with other medications. Bupropion oral tablet can interact with other medications, vitamins, or herbs you may be taking. An interaction is when a substance changes the way a drug works. This can be harmful or prevent the drug from working well. To help avoid interactions, your doctor should manage all of your medications carefully. Be sure to tell your doctor about all medications, vitamins, or herbs you are taking. To find out how this drug may interact with something else you are taking, talk to a doctor or pharmacist. Adverse effects. There are several significant adverse effects been reported for bupropion. Many of these side effects occur in more than 10% of patients. These include cardiovascular, tachycardia, respiratory, rhinitis, pharyngitis, central nervous system, insomnia, headache, agitation, dizziness, dermatologic, diaphoresis, endocrine, weight loss, gastrointestinal, constipation, dry mouth, nausea, musculoskeletal, tremor, ophthalmologic blurred vision,